I'm Wendy Wills. I work at the University of Hertfordshire, where I'm Director of the Centre for Research in Public Health and Community Care, and I lead the ARC, that's the Applied Research Collaboration for the East of England Prevention and Early Detection in Health and Social Care theme. We're a cross-cutting theme in the ARC, so we cross-cut with all the other work that's going on, but we have a particular interest in research that might explore what might prevent populations from becoming ill in the first place, and so that they don't experience disease or deterioration in long-term conditions or developing new conditions. We've got particular subgroup interests and expertise right across the East of England in food and nutrition. We have a really sort of buoyant group that covers malnutrition, food security, obesity, for example. We're also really interested in looking more and studying sort of prevention and early detection of cancer, particularly amongst groups where take-up of screening invitations, for example, might not be as great as we'd like it to be. Certain black and minority ethnic groups, for example, and looking at whether men and women, etc., right across the region are taking up those services when they're offered to them. And we're really interested in carers' health, because we know this comes up time and again when we talk to communities and also talk to our colleagues across the region working on other themes, that if we don't look after our carers and really do research to understand what might support them, then of course they not only is their own health going to deteriorate, but they also can't care for the people that they're caring for, sort of formally or informally. So it's really important that we pay attention to that group. So we've been really busy since the spring in 2020 because of COVID. We wanted to design a project looking at dietary inequalities across the region. So really looking at the challenges that people were facing at accessing food, and whether that's a household with a family and children or an older person living alone, for example, and also looking at the organisations that support people to get food across the region, and that's had to change quite rapidly. There were well-established systems for people getting food, but local authorities had to get more involved in that. So we've been busy interviewing people. We've published an interim report before Christmas, but the work's ongoing because things are changing all the time. New challenges, new difficulties, the longer that these lockdowns go on, and we hear such stories of sort of hardship and difficulty from schools, from older people, from people who can't get out and shop. So we're really keen that that project will keep going, because there's a lot of lessons that we can learn from that and sort of lead the way in the East of England, spreading the word about the lessons learnt. We ran a community photography competition a few months ago. We asked people living in the East of England to take pictures of places that meant something to them. We awarded some fabulous prizes to a small number of winners, but we were so impressed by all of the sort of over 60 entries that we've turned that into a fabulous online exhibition. So everybody can click on a link that will be in our newsletter, and you can have a look at all these wonderful pictures from right across the East of England. I just think it's an absolute joy to see it through other people's eyes, what their special places and what they mean to them. So do have a look at that. We have an ongoing project trying to ask people, what does prevention mean to them? It means different things to different people. What is it people are interested in us doing research on? What do they want us to prevent? And so we get lovely quotes from people as we go across the region remotely, now that we can't do it in person, asking them what it is that they want us to do research on. So that will be an ongoing project. And we're just planning another public webinar that anyone can log on, because it will be online, which is the joy of working like this. But we're really thinking, what is it we need to prioritise? What do different people from across what we might call the system, whether that's a community group, an organisation, people within the NHS, Department of Health at national and local level, how can we prioritise prevention to get the most out of our ARC theme and make sure we're really doing some good in our region? So there's a lot going on, and a lot more that we can plan, despite the times that we're living in, really. We have to keep going and doing this important research.
Hello, my name's Claire. I'm the Senior Research Fellow for the Prevention and Early Detection in Health and Social Care theme. And as Wendy was saying, over the last year, we've been very much focusing on food and nutrition, and looking at the way that COVID and the restrictions have impacted on people's food and eating practices. So we've been, with this ongoing qualitative study, talking to professionals and volunteers in the region and into households to find out how people are coping and what's being done to support them. And we just want to share some of those initial findings with you. So, as I'm sure you already know, the pandemic and the restrictions have amplified health and social inequalities, and this has certainly been the case for food. So from the people we've spoken to in our qualitative study, we've found that it's kind of amplified dietary health inequalities. So people who are existing on quite a low income are experiencing precarity, might not have very good housing or very much space or much facility to cook and store food. That's got a lot worse for them. So they're reporting that it's harder to maintain a healthy diet. Whereas people who might be okay inconvenienced but not impacted too negatively, so they might be working at home, they've got reasonable housing, they've still got a steady income, they've been able to really focus in on food a bit more, kind of use it as a chance to go on a diet or eat more healthily or cook from scratch more and spend more time, eat as a family. So you can see that it's kind of pushing the poles apart. So I just want to show you a couple of quotes. So this one here is from an older lady who lives alone. And during the first lockdown, she stayed indoors all the time. She had to get her family to do her shopping for her. And she found that, you know, as the lockdown went on, she was just less and less interested in food, really not socially eating, not even being able to have a cup of tea with anyone. You know, as the weeks drew on, she found herself not really having much of an appetite, not wanting to cook, and just doing very simple things as fuel and not eating properly. So there is a concern about what happens as people get out and about more, and as hopefully we come out of this. How do we get people back into the habit of it? How do we build up confidence more around food? And to contrast, there's a quote here from a lady who is working at home as an office manager and a professional, and she's really consciously tried to improve her health during lockdown. So she's been going for runs, stopping for lunch, cooking from scratch, setting up a real timetable around her diet and exercise, and trying to use it as an opportunity to improve things. And if you've got the income and you've got the space and you've got the stability, you can do that. So I think in food, it's kind of a replication of the social system in a way, isn't it, with this food system, with how people, how these inequalities play out and the lack of resources. And then just to finish off, one of the things that come up in interviews is who might not be getting fed. So as you know, there were government schemes and local authority schemes to get food parcels to people, which was fantastic, but of course not comprehensive. People were missed. And from the professionals we spoke to, the biggest concerns were around people who might be shielding and got food parcels, so they get enough food for themselves but not for the rest of their household. And if the person is shielding is responsible for everyone else in the household, they're a carer, or everyone else in the household is a child, then how do you go out and get food? That's been an issue for some people. And then also, if you've got vulnerable people who might have addiction problems, who might normally get referred to get extra food through agencies who've been closed or reduced availability during lockdown, there's a concern that some people are being missed or kind of falling through the cracks. And this is something that we're feeding back in our dissemination and in our policy briefings, which we've produced and launched earlier this month, that you can see on the slide, to make sure that our findings feed into practice around health and social inequalities, particularly around food. So if you have a look on the slide, there's a link to our interim report, and there's just a quick shot up there of the policy briefings, but they're all on the website, or will be very soon, to have a look. Thank you very much.
It's been really good. Everything's all gone virtual now, so you get me and my friendly cat. It was really good to work on the policy briefings because I've never done that sort of thing before. So yeah, it was another insight into what happened at the end of the research that I haven't seen yet. I mean, I've been doing PPI work for about the last 17 years, but I've never done a policy briefing before. I just edited it for the team and tried to put the patient's perspective forward and making it easy read and just making the recommendations policy a little bit more punchy and a little bit more stand out, because coming at it from not a member of the research team, I was looking at it new and with a different set of eyes to the people that have been working on it long term.
I'm very interested in the ARC research, and I've been to their meetings. And last year, we gave a paper on community involvement. And community involvement is important because the government and County Hall, etc., are calling for that. And I spoke in my paper about our community, which is an interesting community in Stevenage, in Hertfordshire. Some of the social workers and people who are doing research are having difficulty finding subjects. So I suggested that an excellent way of finding subjects is to go to the local community centre. Example, I'm a trustee for our community centre, so I know it very well. We're offering quite a wide scope of activities within the community, which are well taken up. So we have quite a large reservoir of people that they could draw upon if they're doing research. Anyway, that was the gist of my paper. I showed a lovely photograph of the community centre itself because it's in the high street in the old town. So it's an excellent resource for people. Do involve the community. It's us at the grassroots level who know what the problems are and how we experience them. It's all very well the academics coming along and telling us what they think it is, but it might not be, and quite often it isn't. And some of the things that they are saying now, we've been saying for quite a long time.
Society today has changed so much that it does, shall we say, make me feel a little bit uneasy when you talk about communities and sort of disseminating good advice. And the word that I didn't like the sound of at all in the present climate was prevention. I thought it should be more encouraging people to do things rather than preventing them from doing things, because they've been prevented, and different people adapt differently to being told what to do and what not to do. You've only got to think of children in that respect.
But isn't any time a good time to try and prevent, so that you don't get a situation that we've got where every man in our town, their life expectancy is 10 years less than the men in St Albans, for example?
I think it's the language they use, because the language is negative, isn't it? To prevent something is negative language. It's not an encouraging phrase at all. I think part of it is the fact that whatever we're involved with, we can bring a different perspective to the researcher who's created that piece of research, and it's their baby basically. And sometimes we just bring the critical friend voice that sort of says, well, yeah, it's a wonderful baby, but can you just slightly change that bit about it, and that will make it a lot better. And then it'll really shine. Everyone will want to look in that pram once you've done that little adjustment. So I think that's what we do. We point out how to make what they've done, which is normally really, really good, better, and how we can make it more accessible to the general public, because often that word research just scares people away. So I think in the policy briefings that I wrote and anything else that I've written for the ARC or any PPI work I've done, it's always been just to make things accessible, make things easy, make things short, make comments snappy, just make it less dry.